So we provide substance misuse care, sexual health care, and emotional health wellbeing care for young people aged up to 19, also up to 25 for people with SEN and some disabilities. That includes all sorts, from help with drug and alcohol use through to contraception advice and emotional health counselling.
So our main challenges were, having been an organisation that mainly delivered substance misuse services previously, that we didn't have a system to record sexual health data that we could then use to report both to commissioners and also for the national data sets. And we really wanted a system that would be integrated, so that would support the integrated working of the staff in terms of how they work with young people. So we approached ILI because we were already using the CarePath system successfully for our substance misuse work.
So when we started out, we were running a couple of systems in parallel. They were distinct systems, trying to keep the records in a robust way whilst keeping them good on a substance misuse record system and keeping them robust on a sexual health system. Creating an awful lot of work for the workers. Is sort of doubling up for the record keeping. We really wanted something which would integrate the records all into one record, so that when a client came in, if they'd been seen for some substance misuse work, but now were being seen for some sexual health work, all of their records would be in one place. It'd be much easier for the workers to get on board with that. So that motivated us to start looking for a system that could do this, and it motivated us to get in touch with ILI to see if a module could be added to our substance misuse record system, CarePath.
So we met initially with ILI and had early conversations with them around what it was that we were looking for, in terms of being able to capture information around sexual health specifically for the young people that we were working with, and looking at that from the perspective of an integrated service. From that, we had workshop where we had sort of technical people from Compass, operations people, and some of our clinicians who met with people from ILI. And from that, we were able to identify what it was that we needed in terms of the system working well for staff to use, but also in terms of us being able to produce the reports that we needed. And then from that, ILI produced an initial specification for us. We then looked at that together, made one or two tweaks, but it was very much there actually at that first stage. And then from there, ILI went on to design and build the module for us.
At first, obviously, a new system. However, ILI they gave the training there. The user guides were really clear and concise, so it helped with training up the staff, and once they were able to use it, once they were comfortable using it, they've been really positive.
It's ensuring that we're moving towards a fully integrated system now, because we've got the one system, so the practitioners can quite easily swap between the two elements. It's also making us move towards paperless recording now, because certainly the sexual health element is paper-like. We don't need any paper at all, so we're moving towards that system now.